The most common cause of headache is called tension. According to the American Headache Society, this is what they refer to as tension headache or nerve tension headache. I can tell you that in this case, the patient complains of a headache that lasts for 6 months or even a whole year continuously.
Oh God, that's awful.
Yeah, sometimes the way they describe the headache is exaggerated. If you ask, how long have you been suffering from headaches? They might say a year, a month, or even 2 years. It could be either intermittently or continuously. For example, they might say, I've been suffering for 6 months in pain, then 6 months, fine, or 3 and 3, or even a whole year.
But generally, it's over long periods.
Exactly, long periods of time.
Welcome to a new episode of the podcast. Our guest today is Dr. Ahmed El-Shafi, professor and consultant of ear and nose surgery at the Faculty of Medicine. Welcome, doctor. It's great to have you with us.
Welcome. Happy holidays to you and to everyone listening. I hope you are all well.
Wishing you health and wellness. Let's talk about headaches. What is a headache? And what are its types? And you can explain as much as you like about headaches.
Go ahead. All right, let me tell you something. Headaches actually have a story with me. In my specialty of ear and nose, and the reason was a certain type of headache. So I'll tell you that I used to get it myself and I didn't know what the diagnosis was, and many doctors couldn't figure it out either, to the point that when I decided to specialize, I chose ear and nose just to understand what this headache was. All right, the important thing is, I thought the matter was simple. I spent a year, 2 years, a long time, in fact, it was maybe after 10 years, while I was working on my doctorate, that I finally found out what was causing the headache I used to get. So what was the cause? I'm not going to tell you right now. I'll mention it among the types, the headache. But why am I telling you this? Because you said that the headache is just a guest. I'm telling you, no, it's more like a permanent resident. It really takes over. And there are many people, may God protect us, who suffer from this. For them, the headache isn't just an occasional visitor. It doesn't come and go from time to time like it does. For many people, for them, the headache is a chronic, troubling illness that takes away their freedom and activity, and there are many types of it. When we learn about them, together we'll realize it's not just a guest. Sometimes it becomes a permanent resident.
It's like it's settled in here. All right.
Okay, look everyone, a headache, first of all, is pain in the head. So if I feel pain anywhere in my head, the head is the part right above the neck. It ends at the jaw, the jawbone. So from above the jawbone, yes, from above that line at the top of the jawbone, that's considered the head. If any kind of pain occurs in that area, we call it a headache, okay? Anything inside the head, generally from the components starting with the skin to the muscles, bone to the bone, to the teeth, to the eyes, to the nose, and everything inside it, and the ears, and everything inside them, even the blood vessels running through, and the nerves inside the head. Any disease that affects any of these can lead to a headache. And here's a really interesting fact you might not believe. The brain tissue itself, the brain itself, doesn't actually cause pain. It's not actually painful at all. So if there's a problem inside the brain, but it only affects the membrane surrounding it or the blood vessels within, we wouldn't feel it at all. The brain itself, which we think is the cause of headaches, no, that's not the case. Look, it has nothing to do with it. It doesn't feel pain at all. The rest of the places are complete. Yes, all the layers from the skin all the way to the bone and even inside the bone. All of these are sensitive to pain and can feel pain, and any disease affecting them, whether it's inflammation, a blow, or injury, or even different types, tumors, God forbid, all of this can cause pain, which we call rust. This means rust. Now, as for the causes of headaches, ladies and gentlemen, there are so many causes, because if we consider that every tissue in the head could, if it gets inflamed, injured, develops tumors, or even other diseases, cause pain, then there are a lot of possible causes for headaches in the eyes, the teeth, the skin, the sinuses, and all of that, depending on the area and the specific disease. So there are a lot of causes, but what I can tell you are the most common ones, the most common causes of headache pain. Let's go from the most common to the less common. But honestly, if we started talking about all the causes, we'd never finish.
Yeah, of course, definitely.
All right, so the most common causes are as follows. According to the American Headache Society, the most common cause of headache is called tension. This is what they refer to as tension headache or nerve tension headache. I can tell you that in this case, the patient complains of a headache that lasts for 6 months or even a whole year continuously.
Oh God, that's awful.
Yeah, sometimes the way they describe the headache is exaggerated. If you ask, how long have you been suffering from headaches? They might say a year, a month, or even 2 years. It could be either intermittently or continuously. For example, they might say, I've been suffering for 6 months, 6 months in pain, then 6 months fine, or 3 and 3, or even a whole year.
But generally, it's over long periods.
Exactly, long periods of time. And another thing that helps us identify it right away is that the person has been complaining about headaches for months. And these headaches aren't extremely severe. That's why the person is able to tolerate them. And this happens more often in women. A woman always says, "This headache feels like it's wrapping around my head like this. It feels like something,
Away.
people pressing,
Pressure?
pressure." Yes, exactly like that, exactly like that.
So when I wear, oh, doctor, I have tension. Exactly. So when I get this headache, then this is tension headache.
Exactly. Look, I'm explaining it simply because diagnosing and differentiating between types of headaches is a complicated matter and requires a doctor's examination and the right tools. But I'm just telling you some things, things that a person can use to reassure themselves or understand simply.
Of course. Yes, definitely.
So the first thing, that this tension headache or quiet tension usually happens to people who need rest, who need to get away from nervous stress, and who need to relax the muscles in their neck.
Now I wants to go to the farm, doctor. The farm.
Yeah. So what's the treatment? The farm? All right. The treatment for this type really is at the farm, because we shouldn't focus too much on reading things all the time. Let our neck muscles relax, see what's bothering us, and stay away from it. That's it. Now, another very common cause that I'd also like to tell you about, because it's really very widespread. Most people who come to complain to doctors about headaches when they come to the hospital or go to the clinic feeling unwell, they usually have this type, which is migraine. Yes, migraine is actually one of the most severe types of headache.
So what are its forms, if you don't mind, doctor? Yes. Can you tell us what it looks like? How does it present itself? What is this text?
No, if someone has migraine and is listening to me right now, they'll recognize it immediately and say, "Yes, that's exactly what I have." This headache comes on so intensely that it makes a person drop whatever they're doing. For example, if someone is studying, they have to stop. If they're working, they have to leave. If they're just sitting, they might have to lie down. It's that severe, so much so that it can be accompanied by vomiting, sometimes, or at least nausea.
Because of how intense it is. Yes, it's really strong.
And it comes in episodes, with each episode lasting from 4 hours up to 3 days.
Oh my goodness.
So it starts, yes, the headache can last for about 4 hours, for example. A person may continue to complain for 3 days and 92 hours. But what's strange is that after those 72 hours pass and after the attack subsides, it's as if nothing ever happened.
But it keeps coming back, cancer, like in cycles. It returns every so often with the same intensity.
An attack is basically a bout of headache that comes on very intensely and lasts for a period of no less than 4 hours and no more than 3 days.
But this, well, I can call someone a migraine patient if these attacks are repeated. But if it happened once and then went away, then that was just a single attack and that's it.
Now, according to the American Association, in order to diagnose the condition, they count 5 attacks that meet certain criteria, such as the intensity of the headache, that it occurs on one side and not the other, and that it may be accompanied by vomiting or nausea. The sound and light also add to it. There's also something called photophobia and phonophobia. That means the patient wants to go into a dark room and not have anyone talk to them because sound makes the headache worse and so does light. Exactly. That's pretty much it. I should also mention the location. It usually comes above the eye or on the eyelid or around the eyebrow area. And sometimes people complain about their nose along with it. And these are the ones who often come to us in ENT, thinking they have sinus problems when actually it's a migraine.
They feel it in their head.
Exactly. Yes, it can also be in the forehead here, at the front, or above the ear, or at the back of the head, or even in the neck. That's possible too. But the most important thing about these symptoms is that the pain is very intense on one side, and it comes with vomiting or nausea and sensitivity to sound and light.
And light bothers them. Let me ask you a personal question then, since we're on the topic. What if it includes the eye? Yesterday I woke up from sleep with a headache, starting from my eye and this area here, as if something was piercing into my head through my eye. And of course, I couldn't tolerate any sound, light, or anything at all. No, really.
That's actually very common, and it could be a migraine. Yes, absolutely.
But I woke up from sleep with it.
The headache, yes, waking up from sleep, and that's it. The person goes to sleep. And the headache is very severe. It's actually the second most common cause of headaches. It's not rare. It's actually quite common, by the way. This is the kind of headache that made me...
Yes, it's a specialty that's also confusing, to the extent that even doctors from various specialties might not know what type of headache it is. That's absolutely true. So we've covered 2 types so far.
Yes, now I'll talk to you about a very common type, the one that everyone in passing says, We have sinus problems. I have a sinus headache. This is something you hear in Egypt and outside Egypt, not just in the Arab world, but in foreign countries as well. Anyone you talk to will say, no, no, it's just that I have sinus issues. Of course, I want people to understand what a sinus headache actually is. A lot of people assume they have sinus problems, but they actually have other types of headaches.
They attribute everything to sinus issues when that's not actually the case at all.
Yeah. Maybe because it's the simplest explanation. Maybe people they see it as a mild kind of headache, nothing really serious. I don't really know. But in general, sinus headaches, where are the sinuses located anyway? The sinuses are up here, in the bone. Inside the bone itself, there are air-filled spaces. So the bone above the eye, there's a space filled with air between them, and that air is connected to the nose. That's why we call it the sinus, above the eye, below the eye, and between the eyes. And there's a sinus a bit deeper inside in the brain area. All right, we're going to talk to you about headaches. Sinus headaches are basically headaches caused by acute chronic inflammation. We've all experienced headaches from acute sinus inflammation. It's simply just a bit of a cold.
Cool down a bit.
I have a cold, my throat hurts. We found a blocked nose, sneezing, and heavy coughing. I feel like the bones in my face are heavy. All have our ups and downs.
Of course, I definitely felt that.
This headache, this is the one. It has nothing at all to do with severe headaches, like migraines, or long-lasting headaches like tension headaches. No, this is something mild, where some we just say it hurts. But it's accompanied by mucus and nasal discharge, or a cold, or fever, or cough, or all the symptoms of a cold.
So it's not just a headache on its own. With the other types, it's just a headache. But this one comes with symptoms similar to those of a cold. So that's why we can completely rule out the topic of so-called pre-sinusitis headaches.
Yes, of course. If someone doesn't have any inflammation, no cold, no fever, nothing, then it's impossible for them to have acute sinusitis.
That's completely new information because everyone really does say, no, it's just my sinuses acting up. My sinuses are bothering me and giving me a headache.
Well, I don't want to upset any ENT doctors by saying that patients shouldn't go to them for headaches at first. But actually, most of the time, the doctor who refers headache patients to other specialists the most is the ENT doctor, because of the whole sinus headache story. Sinuses.
All right.
I want to tell you about another type of headache. Sinuses. What is acute inflammation? Chronic inflammation. Chronic inflammation isn't just someone catching a cold. No, it's someone who always has a cold and not just an acute infection. Chronic inflammation that lasts more than 2 or 3 months will also cause the nose to have secretions, be blocked, and there will be phlegm in the throat, causing pain.
Kipti's doctor is here to listen again, joining us for the second time.
Yes, this sinus headache has a feature that a lot of people want to pay attention. Oh, you know what too? This headache tends to get worse in the morning. That is, when someone wakes up, the headache is more intense and it lessens at night.
Sinuses. Yes, that's also another sign.
Yes, one of the characteristics of sinus issues, especially chronic ones, is that we feel the headache in our forehead, in the sinus area above the eye, and it gets worse in the morning when we wake up compared to at night.
All right.
And if we bend down to pray or pick something up from the floor, the headache gets worse.
The headache gets worse.
You feel like there's negative side that can't drain. So we feel when moving the head, especially in the morning, exactly. That's something about the sinuses. Now, other common types. Look, for example, I can tell you that one of the most common types is toothache.
Oh, of course. The whole family suffers from it.
Yes, yeah, exactly. Also, keep in mind, some people don't come complaining about their teeth. But if you actually feel the pain in the tooth, that's good. But sometimes people have a wisdom tooth or something like that, or a tooth with an abscess underneath. The pain doesn't come exactly in the joint. It might come as pain in the ear, or as a headache in this whole area, or in the face.
It acts kind of tricky. Like our elders used to say, the pain acts tricky, so you can't really tell where it's coming from.
Look, this word tricky is just something people say, and some people also use it to refer to the lymph nodes. Like when something spreads to the lymph node, we call it that. But in general, the pain itself is actually one of the most severe types of pain, and the patient can't just ignore it. The patient keeps searching until they figure out exactly where the pain is coming from and what to do about it. But it is a very severe pain. Okay, I want to mention 2 more important types first because a lot of people ask me about them. Yes, high blood pressure causes headaches, and elevated blood pressure does do headaches.
Yes, that's the information we know.
Yes, of course. But let me tell you something you might not know. A patient whose blood pressure is stable whether it's normal, low, or high, as long as it's stable. For example, my blood pressure is low, but it's always low. But the person doesn't feel it. That means they have no problem at all, and the person doesn't feel any headache.
So you mean if it keeps changing? That's when you feel it?
Bravo, well done. God bless you. So if your blood pressure is normally good, and then it goes up, as soon as that happens, you feel the headache. But if we keep having high blood pressure for a while, eventually the headache goes away.
Because the body gets used to it.
Exactly. Well done. So a lot of people say, I came in feeling fine, and it turned out my blood pressure was high. When you ask him about a year ago or 6 months ago, did you have a headache? He says, yeah, I had a bit of a headache and it went away because he didn't look for the cause. Another thing I want a lot of people to know is that if someone has high blood pressure and we discover it and start giving them medication for it, it takes some time for the medication to lower the blood pressure and for the headache to go away. It doesn't mean that if you take a blood pressure pill, your blood pressure will be perfect and that's it. The headache is gone. No, it's not magic. It's just like it was before. No. Even if the reading is perfect, you get what I mean. Even if if you've just been diagnosed with high blood pressure, be patient for 2 to 3 weeks or even a month until that headache goes away. And even if your blood pressure readings are normal.
I need to give it its proper time, right?
Exactly. That's right too. There are 2 types left. I don't want to give you a headache with too many coincidences.
Well, it already gives him a headache.
Of course, when it comes to the eyes, like nearsightedness, farsightedness, and things like that, especially in teenagers, we definitely need to pay attention to that. For example, teenagers around 15 years old can develop nearsightedness, and at that point, reading or watching TV and similar activities can cause headaches, usually around the eyes. Sometimes people say it's behind the eye, sometimes inside the eye, and sometimes it even comes with ear pain. I have no problem shedding light on it. That's all.
Refer him to an eye doctor, an ophthalmologist.
And there's also something else, of course, neck pain and joint pain. Yes, these are among the things that cause headaches in the neck or in the area at the back, and they're very, very, very important issues. The last type, which a lot of people come to me about, is when they say, Doctor, we've had headaches so many times, and we've seen many people with headaches, but I'm afraid I might have a serious problem in my brain. I mean, what exactly do you mean? I mean, I'm afraid I might actually have a brain tumor, that I might have a serious problem. So what could make me suspicious about this headache?
I just sit there thinking about it. No, this is something that makes me think I have a serious issue.
What worries us the most is when there are vision problems along with the headache. Like if you feel dizzy or your vision is blurry, I feel like I'm not balanced with this headache. If you feel like the world is spinning with this headache, or even more than that, if you start vomiting when you stand up.
I mean, my whole life is full of valleys.
Yes, that's worrisome, especially in older children who can actually describe the reasons for their headache and complain about it. But with a child, if we're going to take a message from this, when should we really worry about someone because of a headache? If a person wakes up from sleep, if he has headaches and keeps vomiting, he definitely needs to be thoroughly examined. We need to do a scan.
What could it be?
So in short, vomiting while awake is one of the types of headaches. As I told you, it usually comes with vomiting anyway.
Yeah, that's what I thought. His whole day is ruined like this.
Yes, but if someone wakes up from sleep with a headache and vomiting and also feels severe blurred vision, intense dizziness, numbness, or things like that, or weakness in the hands or legs, no, in that case, he should immediately get checked by a neurologist. That's it.
All right. So these are the serious cases, right? Okay. These are the dangerous cases. Do you have anything else you'd like to add about headache?
No, unless you have another question.
Sorry for keeping you so long, Dr. Shafi, but you really gave us a lot of valuable information, and it was an honor having you on the show.
I'm glad I was here with you and with everyone listening to us, wishing you all the best every year.
Wishing you health and safety as well.
And 1,000 wishes of good health to anyone on your journey.
God bless you, and may everyone be safe. May God grant health and healing to everyone, and we hope to see you in a new podcast. At the end of this episode, we would like to thank the doctor very much for the extremely useful information he shared with us. I'm sure many of our followers benefited from it. Stay tuned for the next episode of the podcast, with a new guest and a new specialty from the channel team. See you soon.